at Insurance Network America. I'm the head of the Financial Services Division here at Insurance Network America, and today's webinar is about reinventing your practice in the post-healthcare reform era. A couple of housekeeping notes before we get started. We still have people jumping on, so we'll just do some housekeeping, and then we'll get right into the presentation. You'll see in the top right-hand corner of your screen, you'll see a menu bar. You'll see an orange box with an arrow in it. If the arrow is pointed to the right, that means your menu box is open. There are two pull-down menus. There's one for questions and there's one for chat. If you do have any questions during this conference, please type that in and send it off. I do look at those throughout the presentation. I will answer the questions at the end. If the arrow is pointing to the left, that means your window box is closed. So you just click on that orange, the top orange box with the arrow in it, and that will either hide or open up your controls. So we are in a listen-only mode, and this presentation should take about 45 to 50 minutes. And let's get started. Here at Insurance Network America, we pride ourselves in being able to develop and give you the best type of educational practices that are available to you. And some of you who are on the call have already seen our first series in the healthcare reform marketplace, which Lori Beck did back, I believe, in November. This is the second phase of this series. There'll be a third phase coming up in February, and you'll see some of the, it'll be more along the lines of product and how product can help you develop and transition your practice or grow your practice however you want to see your practice develop. In our marketplace today, the future for the healthcare agent, what does that really mean? Well, basically we talk about change, and change is always difficult, but change is not coming. Change is already here. And so for a lot of us who are worried about what's going to happen today in Congress or next week, we've already had the impact of the change occur, and now it's how we deal with it and how our practices are going to change and evolve. Employers today have a need for guidance greater than ever before. One of the things that I'm going to do here, the first part of this presentation is really just going to do some factual information. The second part of this presentation is going to be involved in another different industry that went through very, very similar situations and how they came out on the back end. And then third is, what can you do to evolve, change, redesign, and repackage yourself for your clients in the years after 2011, 2012, all the way through to 2014. So, and we talked about employers. They have a greater need for guidance than ever before, and that guidance is pretty straightforward. There are so many changes that have occurred, it's very difficult. Who do you believe and who do you talk to? And we want to position you as the trusted advisor for those individuals so that you have a leg up on your competition. And the reason for that is many agents are hiding, hoping that the storm will pass. And we'll talk a little bit more about that, but we've talked to a number of agents who are just thinking about getting out of the industry or just believing that things are going to be repealed and changed and things are going to go back to the way they always have gone in the past. That is not necessarily true, and we'll see that in a few slides. Agents who are willing to embrace their new roles will prosper. And then the next is, what will the new Congress do? Well, if I had an answer to that one, this would be a really short webinar. We want to talk first about some of the realities, the minimum medical loss ratios. Now, for those of you who are healthcare and group providers in the marketplace, you see here where the legislation has limited the amount of profitability, so to speak, where payouts are at 80% or payouts of loss ratios and payments back to actual members of the healthcare organizations are really at a higher rate than they have been at ever before. I didn't read that to you, but the Secretary says that you have to declare everything that you've done. And on this slide, this is the 20% bucket. So you get 80% of every premium dollar going back to the clients and 20% in this bucket. And if you take a look at everything on the left-hand side and most everything on the right-hand side, what you'll find is that most of those are hard costs and they're pretty much locked in. Unless a carrier wants to skinny down their workforce, scrimp on technology, scrimp on their actual service, there really isn't much that we can take away from this. Unfortunately, for agents today in the marketplace, the very last bullet on the right-hand column is the one that's going to be the most fluid, variable, and the one that's the most endangered at this current point in time. Agent commissions are always going to be affected by any significant changes in the marketplace. Carriers want to maintain their profitability and margins, and you look at this list and determine which of these items can be adjusted or reduced to help profitability and margin expectations for companies. I think you'll come to the same conclusion that we've all come to. So, given that, I want to jump into the fact that the industry evolution post-legislative changes. Believe it or not, you're not alone. And I've done this presentation a couple of times, and I worked and lived through the group qualified plan industries having been evolving since the passage of ETRA in 2001. Almost, well, now it's going to be 10 years since that tax relief reconciliation passed. And what it did was it threw the legislation through the markets into turmoil. And because it was hastily built and it was created and there was no depth of thought process into the market industry. And if that sounds familiar, then we're parallel tracking here. None of the carriers had any access to the clients. At that point in time in 2001, most of the client relationships were with individual clients where there were multiple providers. In certain areas and certain marketplaces, you had up to 100 different vendors working in the same group case. Well, try to get 99 of those vendors to give their information to their competition. It was a brutally difficult situation for us to try to work through. There were no plan documents available, so no paperwork was established, and so everybody was left to their own demise. How do you write a plan document? What does it say? And is it going to be in conjunction and legal with the Department of Labor? No record keeping was in place for the new plan types, so we created new plan types, but there was no way to track where the money was going. Client groups did not want to maintain fiduciary responsibility. Here, again, a lot of the fiduciary responsibility was put back on the onus of the employer. And in most cases, the employer did not have the experience or the financial wherewithal to accept the financial responsibilities or the fiduciary responsibilities for those cases. And client groups did not want to handle hardship and distribution reviews and approvals. That ties specifically into the fiduciary responsibility where you were now liable if you made any mistakes whatsoever, and you didn't have a backstop of a vendor and the deep pockets of the vendor to be able to protect you and have their legal teams and have the paperwork established in such a fashion that you were confident that you would have an actual partner in these plans. But the industry continued to evolve. So as the market settled, so all of those factors kind of settled out and shifted, and a number of factors emerged. The independent agents did not hold the value relationships they once had because, and in this situation, 457 or deferred compensation plans became single vendor in nature. Now you remember I mentioned the fact that we had multiple carriers working in a number of cases, and now you go from 10, 20, 30 different vendors down to one. Well, if you're not working as one of the individuals who has that one product, you're pretty much written out of the marketplace. So what did that do? Well, it didn't really have a lot of effect governmentally, but it did have a lot of effect where large insurance companies and mutual fund companies dictated the market. So previously, the employer-employee dictated the market. Now the vendor dictates the market based on legislative changes. And these firms took a real foothold on sister retirement plans. Once you ended up with one plan, it was very easy to take over a second or a third and lock out your entire competition. It made it for a very, very unsettled time in the marketplace. And then additionally, the competition pricing drove competition down. So competitive pricing went from anywhere from 4 to 6% down as low as 25 basis points or a quarter of a point. Now think about this in your terms. Can you live on that large of a reduction when all of your hard costs are going to be the same, but next year in 2012, you would go from 6% commission on cash flow down to 25 basis points. That is an enormous hit to income. And individuals who stayed inside the marketplace had to find different ways to augment and offset that differential in income. But the market still continued to settle, and in 2005, as an offshoot of ETRA, you ended up with new IRS regulations that were drafted. And these regulations had even more potential to destroy the marketplace, in the qualified plan marketplace, for the independent agents, because the regulators moved the markets from an employee-driven market versus an employer-driven market. So basically, the marketplace was, your client ultimately was the employee. Today, in that marketplace, the employer now becomes the driving force, and employers do not want to deal with the paperwork, the marketing, the communications, the record keeping, the service. So they wanted to offload that as soon as possible. The IRS, and the reason for that was that the IRS wanted to capture and identify more retirement assets and have reporting more consistently with inside the 401k market. This was homogenizing all of the retirement plans, but all of the retirement plans were not written or created equally. So it made for a very, very bumpy reentry into the marketplace. So from 2004 to 2008, the industry lobbied incredibly hard to refine the regulations, just as your industry in the healthcare world had lobbied very, very hard to get what they could get into the most recent legislation. But again, in the end, the winners were the large insurance companies and the mutual fund firms. Why is that? Because legislative mandates made it easier for the employer to choose one carrier, and that carrier would be looking at it from the standpoint of, if I'm the only game in town, I can reduce compensation, I can reduce expenses, and I can increase my margins. And with that, primarily the firms with career distribution became prevalent because they controlled the price and the distribution. So the need for an independent agent at a 6% commission was no longer paramount. If you were working directly for that organization and you were an employee making $30,000, $35,000, the individual companies could price that in and know that they didn't have a driven upside. That individual could enroll 500 to 10,000 people and still get paid the same. As an independent agent, the more they enrolled, the greater their income. So those are some of the changes that came into play throughout this period in time from 2005, and the regs did take effect in 2009. We've now had them for just basically over 2 years. And the settling of that basically meant a couple of different things. Rural markets, independent agents thrived. Urban markets, independent agents became less of a factor. And so what did we end up having to do? Well, here are the results. The independent agent had 3 choices, probably very similar to the choices that you have today. They could do nothing, which actually is a choice. With this option, agents continue to lose market share and just wrote out the changes. I can give you an example of one of those where an individual had 3 cases that they worked side by side with 2 other carriers. And when these changes came into play, the 2 other carriers decided that they were going to sweeten the deal and bring in individual enrollers into the case. They still allowed the independent agent in the case, but the independent agent could no longer write new business. That independent agent lost $100,000 of income in 2009, given the changes that were in place. He's a good friend of mine, and what he did do, well, here's what he didn't do. He didn't sell his practice, which is the second decision that an agent could make. A lot of agents who are at the tail end of their careers, who didn't want to put in the effort to change and reevaluate and then change paradigms and rebuild, they just decided to sell. And what we saw in that marketplace, as I'm sure you're seeing in your marketplaces, you're getting independent agents that are going to be maybe some mega agents where they have the opportunity to expand their practice and consolidate smaller organizations. But the agents that stayed did this. They evolved within inside of the industry. This choice took a number of forms for these independent agents. They moved from selling to servicing. Now, in that marketplace, it was record keeping. I'm not suggesting that you changed into a record keeper for your cases, but this is something that they did. They had the opportunity to fill a void and a niche inside of a market. You may have that opportunity, too, with other products that are available inside of your practices that you may have not even thought about offering, or you may have offered, but not in a consistent basis. They grew. They purchased other practices. They were the buyers as opposed to the sellers. and that what they did was they were able to go from $10 million to $100 million of assets under management. That fixed some of the problems when it came to the reduction of compensation, but it also gave access to more people in an evolving practice situation that gave them the opportunity to offer more products and services. There, in that scenario, it's a greater share of the wallet. One of the things we want to help you take away from this presentation today is how can I develop a strategy that would allow me to get a larger share of the wallet or the larger share of the pie. Anytime there's an opportunity to have a client have 2, 3, or even 4 products with you, what I'll call the sticky rate is highly, highly successful, meaning that client's probably not going to go anywhere, whether it be an employer or an employee. The more products that you're able to put in front of a client and the more that they purchase, the better the chances are that you have a long-standing relationship with that client. And third, the individuals, they expanded. They evolved their practices to incorporate other financial products. They added financial and retirement planning services. They added life and long-term care as part of their product offerings. They partnered with existing carriers and employer groups and worked side by side with them. So in certain situations where the large carriers did not have a distribution partner, the independent agent found a way to partner with the product providers to deliver their products and services at point of sale. Why was this so important? Well, again, it puts you, the independent agent, in front of clients. And at the end of the day, the biggest challenge that every independent agent is to see more people. And if you have the opportunity to work with a carrier that's going to give you the opportunity to see more people, and you're going to try to expand your business, what a great way to do it. So those are some of the things that this industry has to overcome. They had to reposition, they had to reevaluate, and for those individuals who chose this third option, they have grown exponentially in the marketplace. Now, the question is, how does this relate to what's happening in your practice today with the implementation of PPAC? Well, current legislation has changed how you will do business, and that's the same as it was in 2001 and 2004. Now we're looking at it again here now in 2010 and 2011. It's just a different industry, and now it's focused specifically on you and your practice. You have a similar choice as the independent agents groups did in the qualified plan market, which is the 3 things: do nothing, sell, or evolve. So what can you do? Well, review your strengths and weaknesses. We spent a lot of time on this on Tuesday as to determining your strengths and weaknesses. What do you do well? What could you do better? And what do you want to take to offload and get off of your plate that is either a time waster or a revenue drag? This is the beginning of the year. You're probably all looking at your business and trying to determine what it's going to look like for 2011. A perfect time for you to work with any one of our marketing specialists, either on the life, annuity, long-term care, or employee benefit side, and discuss with them what the options are and what tools we have available to help you make good, solid decisions about how you can leverage your strengths and minimize your weaknesses for your practice. Second is to analyze your staff needs for the future. I'm not suggesting that you go and fire your entire staff. What I'm suggesting here is that you take a real hard look at your staff and see who can actually help you get to the next level. Which one of your staff members can you re-educate for certain product lines? How can those staff members help generate revenue for you into the future? And unfortunately, there are some individuals who they may not be able to, so to speak, get on the bus with you as you're going through this new journey. But it's your opportunity now to analyze where you're going, how you're going to get there, and what type of resources you have available. Third, determine your needs for continuing education. I can tell you that individuals who are designated generally make 20 to 30% more in overall commissions than individuals who do not have designations. And I'm not advocating any one designation over another, but if you have letters after your name, it does tend to lead to more credibility. And clients now, with the advent of the internet, they can go and they can punch in information at different associations, and they can look for certified financial planners, chartered life underwriters, CASL designations, and they know that they're going to get a very, very slim view of who has those and who's in their marketplace. And wouldn't you rather have your name pop up than your competitions? So think about how you deal with continuing education and get yourself as educated as possible, not only in your current markets, but in other markets that are going to be ancillary income sources for you in your practice. And then if you're uncomfortable trying to go out and do this yourself, find a distribution partners willing to support and educate and train you and your teams throughout your transition. There's two different areas here. The first area really is working with an organization like Insurance Network America. As I said earlier, we have probably 16 different individuals who work specifically with our agents on all the different product topics, but we also help them, guide them through how do they build their practice, what education do they need, what education is available, how quickly can product be garnered, where to go, what's the market, what positioning products for your best and most suitable situations for your clients. And then also you have the opportunity, if you have another partner as somebody local who you can work with and bring that person in and share case responsibilities. You may never have done a retirement plan before, and you may want to partner with somebody who has done them and bring them in and collaborate so that you get some on-the-job training while that other person is helping you transition. It's a fabulous way for you to build credibility in your marketplace throughout the time that you're developing all of the different levels of your practice. Subtle changes have a positive effect on your practice. And first things first, you have clients, both employers and employees. I cannot stress enough how important this part of it is. If you were just trying to come into the marketplace today and develop new business with no clientele, it'd be very, very difficult. But you already have a relationship with both employers and employees, and you can look directly into that. You have value. You have seen them over and over again. They know who you are, and people tend to want to do business with people they know as opposed to having to start new relationships. So you have a leg up in this opportunity. But the best way to do this with those individuals is to identify their needs. Employers want and need different things than employees. And understanding the difference and being able to cater to those differences is going to create a differentiator for you in your marketplace. So whenever an employer may want to maximize their retirement income for them, not for their employees, employees may need to figure out how to do more college funding for their kids or retirement planning based on what they get. Everything's completely different. So really, it's understanding your marketplace, understanding your type of clientele, and understanding they have different needs. The next is to educate, educate, educate. And as you can see here, I've got 3 different bullets on education. Educate on broader life insurance products. It's not just term insurance. And we here have done, I'm sure most of you have seen the different sales tools that we put out on a weekly basis. Those are customizable. We create those in such a fashion that it gives you the opportunity to have the conversation with a client in a non-threatening way so they can see graphically how things are depicted, whether it's the cost of life insurance, the cost of health care, anywhere from how does combination long-term care and life insurance plans work, or even something as simple as compound interest. We have those available to you. Those are great starters for you. Educate your staff on life insurance paperwork. You're very familiar with the underwriting process. You've been through that before, and you're very familiar with the census. You've got half the battle knocked because you've got most of the information for your clients already in your files. But the final paperwork for an insurance policy or an insurance application gets significantly more complex depending upon the state that you're in. Some states it can be as few as 10 pages. Other states it can be as many as 36 pages. So you really want your staff to be able to handle that. We don't really want the vice president or the owner of the practice spending all of their time filling out life insurance applications or any other type of applications for that matter. So getting your staff educated, and we do a great job of helping individual staff members get up to speed with paperwork and administration. And then Educate your employer groups. I mean, you have them right in front of you. And if you're not asking them about their retirement plans and asset protection, somebody else will. You have an underserved market. In the under 100 life marketplace, probably 98% of that marketplace does not offer some type of retirement plan, either for themselves or for their employees. You're positioned extremely well because you're already talking to those individuals. Now, you might not get all of these cases, but you're going to find opportunities where the employer is going to want to understand and know more about how they can protect their assets and build their retirement fortune. Because those individual small business owners are always going to be looking for a succession plan. And what better way to do a succession plan is to help their employees or their family members have enough assets to be able to help in that succession plan. So education here is going to be the key, as it was with the other industry. The more they became educated, the better they became, the broader their practices, and the ones who stayed thrived. A couple of other things that you need to be looking at, and this is really more of a thought process and a food for thought, is look at the group business that is not in the legislative crosshairs. Sometimes we can't see the forest for the trees. We see the legislation, we hear how it's going to affect us, and we sometimes create paralysis by analysis. Look at the other products that Insurance Network America offers, or that you offer to those individuals, and see how you can leverage those. Cases like dental, disability, accident, and critical illness coverages, worksite products like cancer and vision policies, and then again on our side, the life, the long-term care, both on the group and the individual side. These are products that are viable, portable, transferable, and easy to understand and easy to enroll, and that just adds more credibility to your practice and to your relationship with your employer groups. Look at 401ks, simples, and SEP opportunities with your employer groups. As I said before, almost 98% of this marketplace is underserved. And the reason for that is that employers think it costs too much. Well, working with our group, we can find very, very cost-effective ways to create customized retirement plans for your employer groups, and done in such a way where it's financially beneficial for them and lucrative for you. Look at retirement planning opportunities with your employers and their employees. A great way for employers to give a value-added benefit to their employees at no additional cost is to have them offer up some type of retirement planning analysis. Simple fact finder that allows for you to determine whether or not that employee is either on pace to be able to retire when they want to retire with the income they want, or if they need to do something new. Either way, you have that person right in front of you, and you have access by your employer groups to go and talk to them. You have a leading position here that allows you to branch out in your practice and give yourself greater opportunities for success. And by doing that, you position yourself not only as having the relationship, but you'll be the financial expert for the financial needs of your clients. At the end of the day, you want your clients, whether they be employers or employees, to call you. You don't want them calling another agent or another agency. Once that happens, the relationship is lost and you have no opportunity to grow your practice. The more you offer that individual client, whether it be an employer or an employee, the better your chances of having that client stay with you, the better the chances that your clients will call you first. And at the end of the day, as long as your clients are calling you first for advice, you have now become the trusted advisor, and you've moved out of the salesperson's role into the advisor role, and that creates long-term relationships and long-term income strategies for not only them, but yourself. Let me go back. So basically, it's not enrollment time anymore. In certain cases, you enroll once a year, twice a year, and you may not go back and see them again. What I would suggest that you do is you have access to hundreds of employees. Today we have 4 generations of Americans in the workforce. But what I want you to make sure that you do is you spend more time with the cases that you have. Get to know them better. Get to find out exactly what their needs are. Get to find out exactly what they want. And then from there, you can help them grow and develop. And the reason for that is, going back to the second bullet, is the fact that we have 4 different generations in the workforce. the greatest generation, which is the World War II generation, the baby boomer generation, us 50, 45, 60-year-olds, Generation Y and Generation X. And each one of these different generational groups views business, sales, and life differently. The greatest generation, they came up through the Depression, and they valued hard work, and they protected their dollar. Baby boomers, we've gone through one of the longest boom cycles and one of the longest bull markets in the country. And if you're anything like me, it's more you're spending 18 hours a day working and driving as best you can. Generation Y and Generation X, they're a little different. They don't work to live. They don't live to work. They work to live. So they're going to have less concern about putting in 12 to 14 hours a day, and more as to how their life's going to be enriched by doing non-work related business. And they deal with things a little differently. They're a technology generation. The greatest generation and baby boomers are probably going to be more on the relationship side. If you've got a relationship with someone who's a World War II generation, it was more a handshake and your word was your bond. As you get a little bit longer in the tooth and you get a little bit outside of that, you're going to find that these younger generations are going to be more along the lines of critical numbers and actuarial, as opposed to the time-tested handshake and my word is my bond kind of thing. So you got to understand them all. You've got to be able to meander your way through them all and change your sales presentation to be able to relate to all four of the different generations in the workforce. And that's going down to that last bullet. Each group has a different view on work, life, and family. And the way you sell today changes in the brave new world of sales. So, what are your new opportunities? Well, how many employees leave your employer groups? And of those employees, how many have retirement assets that need to be repositioned? I'm going to challenge everyone on the call. Do you know how many of the employees leave your employer groups on an annual basis? Do you speak with them once they leave to find out how they're doing, where they went, and if they have any questions or have any needs that you can address? How many employer groups need retirement planning assistance? Well, we answered that question a little bit earlier with the percentages, and the percentages are very, very high. It's a simple question to ask, and you'll be surprised what kind of information you get if you ask those type of questions. How many employer and employees are looking for safety? That's one of the things the Insurance Network prides itself in. Our products are built around safety, longevity, and for the long haul. And with us, you have the opportunity to work from probably at this point close to 80 different companies across the entire spectrum of divisions, whether it be annuities, life, long-term care, or health benefits. So we give you as many opportunities to be successful with your clients as possible, not only from a product standpoint, but also from an educational standpoint, from a tactical standpoint, and from an informational standpoint. How many employees and employers don't have a financial professional they trust? That's a big key. And I would ask that question of everybody that you go and see. How many different financial professionals do you have, and where do you rank me as in that hierarchy? Because if there's nobody else, you're number one. And if there are others, you need to find out why they are ranked over you, because it gives you the opportunity to be able to tell your story. And then how many employer and employees want simple, understandable products that protect their principal? Well, that's all we do here at Insurance Network America, and we will be able to educate and train you on those products so that you can simply and succinctly explain those products, fill needs, and be able to expand your practice with your current clientele. Well, what we really are looking for here is for you to take a look and think about how you can become more consultative in your approach to your meetings as opposed to more order-taking abilities. Now, I'm sure a number of us on this call do the consultative approach today, but for those of you who don't, we have the tools and the presentations to help, whether it be a standardized fact finder that allows for you to be able to stay on track and ask questions of your client, whether it's an opportunity to have our sales tools, which elicit communication, questions, and thoughts from your client, all the way up to our product presentation and illustrations that show clients exactly the value of the products that they're going to be purchasing. We have all of those tools available to help you. You continue to make your worksite visits, but make them more frequently. You know, it's not just one of those situations where you do your enrollment and then you leave and you don't come back. It really is a situation where you need to be more visible to your client and to be able to have your clients understand that you're more than just one product or one service. And one of the greatest benefits you have is the ability to ask questions about your client's needs, goals, and expectations. You know, we have the fact finders, as I said before, that keep you on point with those clients. And you'd be surprised at how much information a client wants to give somebody that they trust. We need you to take great notes, and the reason for that is that I think that I was in a workshop this morning, and one of the presenters said that people retain about 10% of what they hear. So it's better that you have the notes in case something changes in the future. You're protected, because now you do have a fiduciary responsibility to those clients, and therefore having that fiduciary responsibility, you need to make sure that what you told the client you can actually respond to at a later date and make sure the client understands it. I've had clients, and I still have clients, that they don't remember what we talked about last year, and every year we do an annual review, and sometimes we have to just, we have to go all the way back to 2009 to reiterate why we've done what we've done. The good news is that their assets continue to grow, so it's not a bad thing. But if you have a situation where your clients don't understand and they feel uncomfortable, then your notes are going to be your key protection in this brave new world. Employ a multiple call approach with each client. We can give you an A to Z turnkey presentation on product value and benefits. We have our marketing opportunity partners, and we have them across the board, whether they're lead generation programs, whether they're fact finders, whether they're software, whether they're, you can build a website through one of our partners. We have the opportunity to help you create your practice the way you see fit in the year 2011 to give you the greatest advantage to succeed and evolve, changing your practice so that you can generate more money than you ever have in the past. So, to thrive, we need you to build stronger and deeper relationships with more clients. That's paramount in any independent practice. We want you to place products that will not be affected by legislative changes and government mandates. We have those products available. We want you to develop a turnkey approach to recommending products to your clients. That's going to be significant. We want you to get to the point of where you're so comfortable with recommending these products that your presentation is simple, foolproof, informative, and beneficial to the clients. And we can help you do that. We can do that via website. We can do that via webinars. We can do that by live meetings. We can do that by conference calls, and we can actually do that by having our carrier relationship people work with you directly as part of the ongoing education that's available to you. So what's the good news? I mean, we talked about a couple of different things so far. We've talked about some history. We've talked about some facts. And we've talked about what is your practice going to look like on a go-forward basis. So what's the good news about your future is that you already have the prospects. What you need to do with these prospects is you need to be their resource. You need to be proactive with them. Don't let somebody else make a recommendation ahead of you. Be proactive. Let no one else in. The more you position yourself as the trusted and valued advisor, no one else is going to have that opportunity. They're going to know, your clients are going to be able to say, when someone else calls, that I work with Bob, or I work with Dave, or I work with Mary, or I work with whomever. And you have that relationship solidified because you're offering multiple solutions to your clients' needs. Diversify to bring necessary value, and that really talks about what we've been talking about throughout the first 30 minutes or so of this presentation, which is having more product, having more opportunity, being able to offer more things to your client to give them the opportunity that you are a valued partner, not just a salesperson. Be solutions versus product oriented. It's very simple to say that I've got this product and it costs this much. Now, you're going to win if your price is less than anybody else's, and you're going to lose if it's more expensive. We want to make sure that you stay away from a product-oriented presentation that basically just talks about just the features of product. Create solutions that elicit the value and the benefits of those products and how those are going to help your clients attain their goals long-term, short and long-term actually, into the future. If you're doing all of these things, the great news is that your practice will grow. So where do I start? Well, consider working with another professional such as a CFP, CLU, or CHFC. In that respect, it goes back to what I said earlier. If you can bring in a partner, an individual who's been doing this for a while, they can help you transition your practice and they can help your practice grow. You can also learn on the job. It's very difficult to do business if you're learning how to do it. I've heard one person call it, do you want somebody else to shave on your face? Well, probably not. So you don't want somebody to learn how to shave on your face. You want somebody else to be able to you want to be able to learn from somebody else, and this is a good way to do it. But if you don't have one of those individuals, we can help from an educational standpoint. We can help walk you through as best we can. But again, anytime you have the opportunity to work with other professionals, it gives you just much, much more credibility. Your client will understand that it's just not you. You're bringing a team to your clients, and that's really incredibly invaluable. Partner with Insurance Network America, an organization that not only has products you need to diversify, but one that also understands you and your practice. The reason I say that is because most of you on the call either know of us or work with us. And if you work with us, you know our value added, you know our mission, you know our strengths, and you know that what we provide for you, our clients, the agent. So in that respect, we can actually help you diversify your marketplace, and you don't have to go someplace else and build a new relationship. It's all right here for you. Consider using proven fact finders to uncover the needs your prospects or clients might not realize they have. Again, using a fact finder keeps you on point. It doesn't allow you to deviate. It gives you the opportunity to get in and get out with the maximum amount of information that you need to help a prospect or a client to develop their insight as to what their goals are, where their gaps are, and what solutions you may have available for them. And then INA offers products and solutions that have safety and security built in for your clients and your clients' needs. So when you take a look at the products that we offer, we will make sure that you know all of the benefits of these products and why you're offering those products and those solutions for the betterment of your individual clients. So what are our next steps? Earlier I talked about the fact that Lori had done a couple of webinars late last year. This is our first series here in 2011 as far as the transitioning of practices go. Our next steps are to take a look at the next series of webinars, and these are now going to be product seminars or webinars. And these webinars, one is going to be offered through the North American Life Insurance Company. It's going to be products you can use, and Life Insurance Made Easy is going to be the topic. And it's February 1st at 9 a.m. and February 3rd at 2 p.m. Mountain Time. And then the key family of companies is going to talk about small group alternative funding, and that's going to be on February 16th at 9 a.m. What I would suggest you do is once you get off of this webinar, go to the Insurance Network America website, click on our website calendar, and take a look at the different type of educational programs that we have built in. You can pick and choose and register right on there for any one, two, or all three of these educational workshops that we're talking about today. But also you can go in and you can take a look at our sales tools. Take a look at our product lineup. Take a look at all the different things that we have available to help you. Start thinking about your practice in a global environment and what we can do to help you get from point A to point B as you transition and grow your practice. So in conclusion, by establishing a consultative approach with your clients, you have the opportunity to deepen your relationship, thereby uncovering your client's needs. That is a very powerful statement, and we want you to take that one to heart. A consultative approach will help you deepen your client relationships, and you will uncover client needs, and they will tell you more and more about their situation. Now this next bullet is very interesting because recently New York State has mandated legislation that says you must tell your client exactly how much you're getting paid. So full disclosure of compensation may be required in the future. It is already here in the state of New York. I say embrace disclosure. If you have the relationship with your client, they will accept your value and pay for such value. And frankly, you're going to be no different than anybody else. If you're offering ING's life insurance and somebody else is offering ING's life insurance, you're both getting paid the same amount of money. So by the disclosure, it's not going to be the fact that they're not going to buy from you because you're too expensive and you make too much money. Everybody makes the same amount of money. If they understand your value and they understand why they're doing what they're doing, people will pay for value. Educate yourself by obtaining new licenses or designations. This only strengthens your relationships with your clients. Well, as I said earlier, just a simple designation on your business card increases income by about 35%. That's powerful. So clients will take you more seriously with the designations that you acquire and have. It shows that you're staying, A, on top of the financial regulations and educating yourself on new products, services, and information that's out there in the marketplace. And let's face it, you want to be working with a doctor who is current on current medical situations, not a doctor who hasn't opened up a book in the last 10 years. And that would be true of your financial advisor, who should be you in your practice with your clients. And then look to your trusted partner to offer new and valuable products to your clients. I know here at Insurance Network America, we reevaluate our products every year. We put on 3 new life carriers, a brand new annuity carrier this year, and 2 new long-term care carriers. I know that there's been some transition in products on the employee benefit side as well this year, and we continue to grow those. And I believe one was taken off and 2 were added. So we are always constantly striving to put the best products in front of our customers, you, to help you put the best products in front of your customers, your clients. That is really the key goal in this whole thing. Think about where you want to be, how you want to get there, and who can help you. Those are really going to be the keys for 2011. We stand ready and willing to communicate, educate, support, design, and build product and educational materials for all of our agents in our marketplace. Our goal is to help you grow. And to that end, the more we offer for you and the more opportunities you have to put yourself in front of your clients in a positive light, it's a win-win situation for everybody. You, your client, and Insurance Network America. I noticed that there are no questions, at least I'm not seeing any in our presentation, and we're just about there. It's 45 minutes was our hit number, and that's exactly where we are on this call. If you do have any questions, you can go to the website and email us. If you're working with one of our marketing specialists, please give them a call and ask them to communicate your situation to either side of the house, whether it's the employee benefits group or the financial products division. And we will make sure that one of our professional marketing specialists gets to you and helps walk you through whatever your needs happen to be. If it's product, if it's education, if it's presentation, we're here to help. So once again, I want to thank everybody for your time. I appreciate you taking the afternoon to do this. Hopefully this was beneficial and gave you some opportunities to think. And we look forward to your business. Thank you once again, and that will conclude this presentation. Appreciate it very much. Thanks.